Good evening, I'm Stone Grissom, and welcome to our live coronavirus pandemic special report. Tonight, we have a doctor from Catholic Health Services to help you sort through what's going on with COVID-19 in our communities and across the region, and really across the nation. We also want to hear from you. Call us at the number at the bottom of your screen. This is a call-in show. We want to hear from you. 516-393-1800. So how much is a human life worth? That's the question asked today by Governor Cuomo in reference to unpausing the economy. He says the faster we reopen, the lower the economic cost, but the higher the human cost. Cuomo claims his plan avoids the trade-off between economic and human cost because it will be controlled by officials constantly monitoring facilities and fatalities and hospitalizations. Now, statewide, the numbers of confirmed cases are on the decline right now. It now exceeds 320,000. Look at those numbers. Just let that sink in for a number. That's since March. Upwards of 75,000 of those are right here in Nassau and Suffolk. The May 15th deadline for Phase 1 reopening, that is approaching. Both county executives say they hope to meet the CDC benchmarks by that time. Now, Suffolk County has seen a slight rise in hospitalizations. That's for the second day in a row. Meanwhile, Nassau had its 20th straight day of declines in the number of COVID-related hospitalizations. Now, statewide, the mounting death toll, this is something we don't really want to talk about, but we have to. 19,600 more than that. Look at that. More than 3,100 of those lives lost are Long Islanders. All right, let's get to our conversation right now. Joining us tonight, Dr. Patrick O'Shaughnessy, Executive Vice President, Chief Clinical Officer for Catholic Health Services. Thank you very much. Let me ask you this: as you see those numbers, they're heartbreaking, they're staggering. Do we see a glimmer of hope, though?
I mean, we do. We obviously we talk about the lives lost. I mean, these are all people. It is horrific. There's no question about it. But we don't also talk about the 80% plus that are getting better. I'll tell you, at CHS alone, Stone, we've had over 2,400 discharges home because of the heroic efforts of our first responders, our healthcare professionals doing an amazing job. So, you know, the light at the end of the tunnel is getting bigger. To the point you mentioned in the opening segment, we're seeing trends go down. That doesn't mean we're out of the woods yet. It means just the light at the end of the tunnel is getting a little bit bigger.
Yeah, so when we hear that perhaps by May 15th we can slowly start opening up, from a medical perspective, from what you're seeing and the declines that you're seeing throughout your facilities, is that seem appropriate?
Well, again, I'm not a politician. I'm a physician. And one thing I can tell you is, looking at least our intrinsic data, then the county data and the state data, and the governor will share this as well, we haven't seen a brisk drop off in cases, right? The slope of that decline has been very gradual, and it's almost, you know, there's been some plateaus along the way. So I don't know that anybody has a right answer to this. You know, we're trying to balance all this out. We're trying to make sure that, at least on the healthcare side, we have adequate resources, personal protective equipment, we have hospital bed capacity, we have all the things we need in place, you know, in the event that we do start to see some degree of surge or increase in number of cases after, you know, the pause is over or we unpause.
Okay. Let's get some of the questions in right now. Jane from Lindenhurst. Are you there, Jane? Jane, are you there? Jane, I think I hear you. Is that Jane? Are you there? I'm not sure Jane is there. Is Maria there, perhaps? Jane or Maria? All right, I think we're going to try to fix whatever connection issues we're having right now. In the meantime, let me ask you this, Doctor. You hear a lot about, look, we're heading into, you know, heavy spring, perhaps into the summer. We may see a respite from this virus, but the fall is just around the corner, and that's flu season. So what's the danger of a resurgence, and how complicated could that be with flu season?
So it's pretty clear. I think the social distancing, all the work that we're doing, and then look, it's taxing on everyone, right? I think it's had a benefit. And if you look at the total incidence and prevalence of active COVID-19, those cases are trending down. Once we do, and we do need to at some point, move our way back into society again with safe precautions, we'll see some additional cases begin to trickle into the healthcare system. The concern with influenza, or as we move into the fall, is that, again, we'll see rates of people that could potentially have symptoms of flu. And guess what? Symptoms of coronavirus could be very similar, especially in the beginning stages. But the morbidity and mortality with COVID is much different than flu. So that means for all of us on the healthcare side, and we do this every day, we're all professionals at this. We've had diagnostic testing in place. We can quickly determine, in under an hour, in 30 minutes, whether or not someone has COVID infection or influenza. But we're going to see more, higher rates of hospitalization. And again, this will be a different flu season, meaning flu 2020 into 21 than what we had into 19 into 20.
Okay. Let's see do we have the phone lines ready for us? Is there Jane from Linden?
I'm here now.
Oh, there you are, Jane.
Yeah.
Well, we missed you. We missed you for so long. You made us wait. Well, what's your question tonight?
My question is about this new syndrome that the kids are having, the Kawasaki or toxic shock syndrome, and I'm wondering if it has anything to do with adults. If adults are, or maybe we didn't think to look before for any of those kind of symptoms, but maybe this accounts for the body aches that they're having, the high fever. I don't know. It just seems to be a little bit of a mystery, and I was wondering if any of the adults.
Okay, doctor.
Yeah, so Jane, that's a great question. And what you're describing is what's been termed multi-system inflammatory syndrome. And this has been seen in a handful of cases in New York City and also globally, where pediatric patients develop a vasculitis. What is a vasculitis? It's an inflammation in the medium-sized blood vessels in your body. Most times, outside of the setting of COVID-19, this is an autoimmune condition, and it's treatable with things like IV gamma globulin, even anti-inflammatories such as aspirin. The issue, what we see with COVID infection, is there are components of change in your blood coagulability profile. People become what we term hypercoagulable, or more likely to clot. And so relating to children, this is a real area of concern, because one of the areas that could be impacted could be the coronary blood vessels in your heart. So when we see a kid that presents with symptoms of Kawasaki, which could be rash, abdominal pain, diarrhea, sometimes oral lesions, our pediatricians know, they jump on that right away, and we get the diagnosis and we treat it appropriately. It's interesting to think about this, though, in the context of COVID-19 and whether or not this is causing some of the same symptomatology in adults. And the overall answer is it very well may be. And I know our clinicians in managing COVID are actively managing and assessing the coagulability profiles of our patients and taking appropriate steps to make sure that they're treated appropriately.
Okay, let's try to get Ermine from Hempstead. Are you there?
Yes, I'm here.
What's your question tonight?
My question is, quick question. My friends have been encouraging me to take the emergency vitamin C. I want to know, does it have any marginal benefits for minimizing the effect of the virus?
Okay.
Build up my system in order to fight the severity of the COVID if I am infected.
So, Ryan, great question. I'll tell you, I'm a big personal believer in use of supplementation. Vitamin C, in fact, at one point, IV vitamin C was part of our protocol in treating patients with COVID. Now, orally, when you ingest vitamin C, it's a water-soluble vitamin, which means that the likelihood that you're going to develop anything serious from taking too much of it is very, very low. It is very safe. In fact, Linus Pauling is, the father of research for vitamin C and has published numerous papers documenting benefit to your immune system. It's really called antioxidant therapy. You're giving your body an opportunity to scavenge and remove free radicals from your body. Now, relative to your question specific to COVID-19, there's been equivocal evidence in the literature whether or not vitamin C is beneficial or not. And again, remember, in those settings, it was given by high dose, far greater than what you could take orally by IV. So again, in terms of definitive treatment against COVID, unclear, but in benefit to your body, clear benefit. So again, in anything, all things in healthcare, first, do no harm, right? And number two, assess the risk-benefit ratio. Benefit to taking vitamin C just for your overall health and wellness and to keep your immune system strong far outweighs any risk. And I would recommend, as part of your normal dietary routine and supplement routine, it could easily be a part of it. But again, consult your physician before you take any supplements.
Okay, we're going to take a real quick break. We're going to have much more expert advice on how to keep you and your family safe from the coronavirus. Remember, we want to hear from you. Give us a call. The number right there in the bottom of your screen. We'll be right back. Welcome back to our live coronavirus pandemic special report. Let's bring back in Dr. Patrick O'Shaughnessy, Executive Vice President, Chief Clinical Officer for Catholic Health Services. I think we have all of our issues worked out with with our phone lines here. So let's go right to them right now. I think we have Rita on the line.
Yes, Rita from Floral Park.
What's your question tonight?
My question is, now that summer is coming and pools is supposed to open, is it possible chlorine could kill the virus? And if not, would it be better to keep the pools closed?
So Rita, that's a great question. When you think about it, chlorine by its very nature is meant to kill all pathogens. And from what I've read, and again, I'm not by all means an expert on pools and chlorine levels in terms of what their efficacy is for killing coronavirus, but actually at the parts per million or concentration of chlorine in pools, it actually has been shown to inactivate coronavirus. And furthermore, coronavirus doesn't really spread by water. In fact, I believe on March 10th, the CDC, Centers for Disease Control, put an actual posting out around that. That's not likely that it's being transmitted through water transmission. Again, it's respiratory droplets. So I'm within 6 feet of you, I sneeze, those droplets, either make their way through your mucous membranes and into your body. So I would tell you that in all likelihood, although again, I'm not the expert relative to pools, it is likely safe for you to swim. But again, the key issue will be, where are we in terms of our total numbers of potential COVID positives, and the whole issue back around social distancing. So if you're in your pool by yourself or you're 6 feet apart from other people, you're likely more safe. But if you're in a mass environment with a lot of people around and there's still concerns about active spread of coronavirus, then maybe the pools are not such a good idea. Again, I'll leave that to our governmental officials to decide based on the public health data when they feel it's safe. And one of the key measures we use to monitor that is the infectivity rate, or what's called the R0. That gives us a good sense. When that number goes up, that means more and more cases of coronavirus could be spread and the transmissibility is higher. We need to take more precautions.
Okay. What about Henry? Henry there from North Merrick?
Right.
What's your question tonight?
My question is, my wife likes to use Tylenol quite a bit for everything, and I used to use oxycodone, but I don't really like it, so the VA hospital has prescribed for me ibuprofen and occasionally Advil. I saw Dr. Gomez on CBS News has been pushing, saying don't take Tylenol. It's not good for you, too much of it. Take ibuprofen and Advil occasionally.
So you're asking about the difference between the two, and like which ones you should take?
No, one of my friends recently played a tape that his best friend, who works in Manhattan hospitals, has been working for 2 months, on the front line, has been saying that just about every single case of people who have lost their lives have been taking ibuprofen and Advil.
Okay, so the question is about ibuprofen. We just got to get to the question real quick. Doctor, should he be taking ibuprofen?
So I think I have a sense of what he's asking. First of all, if he's at the VA, I want to say thank you for your service, number one. Number two, I would tell you, you're likely safer taking, in this situation that you're describing, Tylenol versus ibuprofen. But remember, any medication is a drug, and there's actually even evidence to say if you've got low-grade fever, temperature 100, 100.468, up to 101, you may not want to take anything. So again, given what your choices are, and it depends on your age, your risk factors. Do you have, concomitant or coexisting kidney disease, right? So ibuprofen could be a stress on that as well. But again, Tylenol as well, there's clear dosage limitations to taking that medication safely. Given the choices and given what Henry, you're describing, I would tell you go with Tylenol first, take the recommended dose, don't go above that.
Okay, let's try to get squeeze Tony in. Are you there, Tony?
Yes, Stone, thank you. Dr. O'Shaughnessy, always a pleasure. The high infection rate in hospitals was always an issue before COVID-19. We have to be responsible in our practices with masks, gloves, social distancing, cleansing of the trains. What is the hospitals looking to do now, and what are they looking to do in the future to upgrade their cleanliness and sanitizing of the hospitals?
So it's a great question. We're taking active steps at Catholic Health to make sure all of our facilities are clean and that there's no risk for patients coming into our facilities of contracting what you're referring to as nosocomial or hospital-based COVID infection. What are we doing? We're doing things like terminal cleaning with strict high concentration antiseptics and cleaning solutions. We're looking at different UV sanitizing mechanisms. They almost look like robots that can go out and sanitize the air, changing the level of air filtration in our procedural rooms, in our operating rooms, to make sure that we're filtering out any potential contaminants. And we're creating completely clean COVID-free sections in all of our hospitals, including our operating rooms, our procedural areas, our post-anesthesia care units, and making sure that our employees also are screened and checked for signs of infection so that we can pick up on this sooner than later. So I think with those things that we're putting into place, and remember, this is not our first rodeo. We agree. COVID is a scary disease entity, and we're taking even extra precautions over what we do every year for things such as flu, methicillin-resistant Staph aureus infection, C. difficile infection, all of these things. So
I'm so sorry, Doctor. We just ran out of time. I appreciate all that you do for us. We'll be right back.